What was the purpose of the TAILORx clinical trial? Joe, share with us, what was the purpose and the scope of the TAILORx clinical trial?
Well, when the Oncotype DX assay was first introduced, it was obvious that it had great clinical value for some patients, and those included patients who had either a high recurrence score where the value of chemotherapy was very clear, or a low recurrence score where we knew that patients did very well with endocrine therapy alone. There was less certainty about what the right direction was for patients who had a mid-range score. So the trial was really designed to address that very specific question.
And as part of the team that was involved with that, there was a little bit of a shift of the intermediate recurrence score. I think the statisticians wanted that, didn't they?
Well, I would say that that was driven more by the clinicians, because we had a pretty extensive and vigorous discussion and debate, if you will, about what the range should be, and what we felt was that since we were taking a group of patients who would normally be getting chemotherapy by standard practice guidelines, we didn't want to be undertreating patients that we thought that there was who were clearly benefiting from treatment. And so we went through a variety of exercises to try and identify what we thought the optimal cut point was for the randomization. And one of those exercises was to dial down the recurrence score and to in the upper range, and then reevaluate the NSABP B20 data and ask a simple question: did the patients who had a recurrence score of 25 or higher derive the same benefit as those who had a recurrence score of 30 or 31 or higher? And the answer was yes, it was a similar benefit. So that's why we settled in on 25.
Well, I really enjoyed enrolling patients in the trial. I was a big enroller. I think the trial, when did it close? And I think the enrollment was overwhelmingly successful.
It was very gratifying. The trial opened in April of 2006 and closed to accrual in October of 2010. At the time the trial closed, it enrolled about 10,260 patients, of whom about 6,900 had a mid-range recurrence score and were randomized to chemotherapy versus no chemotherapy. The remainder of the patients were pretty equally split between the high recurrence score group and the low recurrence score group. And we follow those patients in a registry, so we will have outcome data to see how those patients did as well.
Yeah, absolutely, and it sounds to me like the statisticians ought to be very happy with how everything worked out.
Well, one of the issues that we had was the fact that the non-adherence rate in the randomized arms was higher than we projected, and so in order to adjust for that, we had to increase the sample size of the randomized group from about 4,400 patients that we initially anticipated to about 7,000 patients to make sure that we would be really confident in the answer that we got.
Okay. Are you pleased?
Well, we're pleased that we completed the trial, and we're very grateful to all of the women who participated in the trial and their families. We're grateful to the community of researchers, clinical researchers, and clinicians who put patients on this trial. So there were a lot of us, including myself, who questioned whether or not we can do such a trial, that we can really ask women, would they be willing to be randomized to chemotherapy or not? And they did, and they embraced it, and hopefully that will lead to, I think, a much deeper and better understanding of how to treat our patients.
Great. Well, Joe, let me thank you for being one of the leaders of the TAILORx clinical trial. This is a great trial. We're looking forward to the results.